every patient who has been sent to the hospital for either as unfit to stand trial or having been found not criminally responsible on account of mental disorder have to have regular review board hearings. And for those hearings, the psychiatrist and the case manager, as well as the social worker, will prepare reports. So those assessments are risk assessments, treatment needs assessments, and recommendations to the review board. Importantly, we are asked to have an opinion as to whether the person still poses a risk to the safety of the public, which is the ultimate question that the review board has to address, and how treatment can help to reduce and manage that risk.
Every patient is unique in their needs as well as the reasons that have brought them to our service. It is about supporting their strengths as well as some of their challenges, and so it tries to be holistic in nature in order for all of the needs of the patient to be met. The overall goal of the work that we do in clinical forensic psychiatry is that we attempt to rehabilitate and to move people to community reintegration as soon as it's safely possible to do so. The core treatment team has input into the plan in communication with the patient. It is a multidisciplinary approach, and so the psychiatrist, the primary nurse, and the case manager, and the social worker, as well as other team members, would meet with the patient, establish the direction of the plan, and so the patient is involved and aware of what the expectations are, as well as what their interests are and their level of engagement. And then the unit staff would be responsible to continue to monitor and support the patient in that treatment plan. So the overall role of case management services is to be a consistent person to oversee the care needs, so the clinical as well as the medical and psychiatric issues of patients at the hospital. And that one case manager will follow them all through the hospital. So that way, even though they're dealing with different team members, it remains the same case manager.
Well, forensic psychiatry is a specific sub-area of general psychiatry that focuses and specializes in mental disorder and the criminal justice system. Psychiatrists do essentially two major roles. First is assessments for the courts and for the review boards, and secondly is treatment of patients who've been admitted or referred to our service. The role is to assess the patient's needs and provide the necessary treatment and assist the patient with the help of the other treatment team members throughout their stay in the forensic system to ensure that we provide evidence-based treatment both for mental illness but also for addictions in an integrated, coherent and consistent manner that aims at reducing risk to manageable levels and to help the person reintegrate and return to society in a safe manner.
The nurse's role here at the Forensic Psychiatric Hospital comprised mostly of the frontline caregiving staff. The primary nurse would be sitting down with their assigned patients and then essentially working through a care plan. And the care plan would be multifaceted. It would be very patient-focused, so each care plan would be unique to each particular patient. A big part of that role would be mental status examinations, frequently assessing the patients for their mental state, essentially seeing how they're doing on a day-to-day basis. The role of the nurse within the team, because it is a team approach here, is that they would report back to the rest of the team how the patient has been progressing, how they've been responding to the medications, and essentially how they've been behaving on the units.
The social worker is involved from the moment of admission to hospital through the treatment phase, through the hospital, and through working towards a discharge plan leaving the hospital. When a patient is first admitted to hospital, the social worker would be looking into getting a legal aid application done, looking into income assistance eligibility, and getting collateral from family supports and community supports. The social worker remains with that patient through the entire admission, and that's very helpful for family members as well, that they have one contact person that they develop a working relationship with. The goal of the social worker as a part of a treatment team is to assist the client in making a transition while they're in the hospital, whether it's from one unit to the next unit, through the course of their admission, as well as making the transition from hospital to community, and also making the connection or reconnection in some cases with family members. In terms of working with families, that can take place in terms of in-person meetings or teleconferences or video conferences, whichever works to the most convenient factor, I guess, for the family member. We provide updates often on a one-on-one basis in terms of the social worker contacting the family member, and we also extend offers of teleconferences or video conference to provide opportunities for families to meet with the treatment team in order to ask any questions that they may have, and to meet with the members of the team that are working with their loved one.